This video provides an overview of how the Cheetah Non-Invasive Cardiac Output Monitor, or NICOM, obtains its data. NICOM uses 4 sensors applied to the right and left sides of the chest to create a thoracic box. Each sensor has a double electrode configuration consisting of an outer transmitting electrode and an inner receiving electrode. A low amplitude AC current with a frequency of 75 kHz is applied to the thorax from the outer electrodes. The inner electrodes measure the returning voltage. The thorax resists the passage of current, and reactive elements in the chest oppose the change in electrical voltage. The thoracic resistance and reactance together create a time delay between the current and voltage, resulting in a phase shift between the applied current and the measured voltage. This phase shift is highly correlated with the aortic blood flow, permitting calculations of stroke volume.
Now, as we've seen already a little bit how the device works, there's the electrodes that are placed. Each electrode has 2 sensors in it, an inner and outer sensor, and a current is applied from the outer sensors, and these are, which I'll talk a little bit about. It's very cleverly done. There's actually 2 sets of measurements, one from each side of the body. It applies a current. We've got then on each of these sensors, there's an inner set of electrodes, and the outer electrodes provide the current, shown with a known frequency in red, and the inner ones sense this current. So the signal actually comes with what they described as the phase delay here. And if conceptually we say that the inner current, shown in yellow, initially they all line up on each other, but as the heart fills, there's a shift in the phase of how the sensed signal relates to the injected signal shown in red. And eventually, we call this a phase shift. And it is then the maximal rate of this phase shift that is multiplied by the time over which ejection occurs and by the ever-present constant that allows for the calculation of stroke.
The NICOM system uses a measured phase shift to derive the maximum aortic flow, and using the ventricular ejection time is able to calculate the stroke volume. The cardiac output is calculated by multiplying the stroke volume with the heart rate. Variability in the stroke volume measurements over time, SVV, is also reported and has been used as an indicator of whether or not a patient is fluid responsive. Stroke volume calculations are measured for every heartbeat, averaged over the minute, and updated every minute. Although calculations could be obtained by applying only 2 sensors on one side of the thorax, the NICOM system uses 2 sensors on each side of the chest and then averages the stroke volume measurements, effectively doubling the data used to make the calculations. Cheetah provides the following animation to depict the difference between measurements based on frequency and amplitude and the difference between bioreactance and bioimpedance measurements. Imagine a rock thrown into a pool. The disturbance creates waves that travel outward in the pool. The distance between the waves, or wave frequency, remains constant. The height or amplitude of the wave progressively decreases as the wave travels outward. Bioreactance is based on changes in frequency of the applied current, in contrast to bioimpedance, which is based on changes in amplitude. Electrical noise, motion, and respiration have minimal effect on bioreactance measurements. Bioimpedance is affected by electrical noise, movement, and respiratory artifacts. As a result, NICOM sensor placement does not have to be exact, and measurements remain accurate despite body size, obesity, and edema. Bioimpedance sensors require accurate placement, and measurements are affected by obesity and thoracic fluid content.
So what about bioreactance? So we're going to talk a little bit about bioreactance. So this differs from bioimpedance. So with bioreactance, you have electrodes which emit an electrical signal. You then have electrodes which receive the signal. With bioimpedance, one looks at the change in amplitude. With bioreactance, one looks at the phase shift. So that's the way the direction of the electrical signal changes. So pulsatile changes in thoracic volume, which is stroke volume, induce a phase shift, which are continuously being detected by NICOM's phase detector mechanism and captured in the form of a NICOM signal. So instead of looking at the change in amplitude of the signal, it looks at the change of phase, which is the angle, and that's related to the dynamically the stroke volume in the thoracic aorta. So this is schematically what it looks like. You have 2 electrodes on each side, an emitting and a receiving electrode. And the formula, this is the formula for stroke volume, which is a constant times the ventricular ejection time, which it gets from the EKG signal, and that is the phase change. So it's the phase change over time. So it's important to note that, look at this formula, which differs significantly from the formula which is used calculate bioimpedance. In bioimpedance, you need the distance between electrodes, and that becomes an enormous limiting factor in bioimpedance. With bioreactance, it's independent of the distance between the electrodes, so therefore the nurse can just slap them on the chest, doesn't have to accurately measure the distance between the electrodes, and really it's not affected by the baseline thoracic impedance.
When the NICOM sensors are applied and connected to the monitor, a self-diagnostic calibration test is performed, and the quality of the signal is evaluated. The time required to perform the calibration is typically 90 to 120 seconds. To minimize the calibration time, the patient should be instructed to refrain from moving or speaking. Occasionally the signal may be inadequate, and an error message will appear which identifies which sensor is faulty and needs to be checked or changed. If a sensor error message appears, check the sensors and cable connection, and then wait a few more minutes to allow stabilization of the sensor signal. If the error message persists, the faulty sensor will need to be replaced.